Hi, my name is Jim. I'd like to take just a moment to tell you a story that's very dear to my heart. Probably almost a year ago, my wife had some serious problems with her jawline. First, because of where it was in the position, she thought it was a problem with her teeth. She's in a great deal of pain. We made an appointment with the dentist, went down, we took x-rays, they examined her, looked at her teeth very closely and just said, it's not your teeth are fine, there's no problem there. Must be the nerve that's inside your jaw. You need to go to a regular medical doctor and have that checked out. So we did that day. I called our general practitioner, went down, got an appointment. She saw how much pain that my wife was in, and I mean, to the point of being in tears, not even able to function very well. So she made an emergency appointment with the pain specialist, and we went immediately from our own doctor's office over to the pain specialist office. They took her in immediately. They did x-rays, they checked her out, planned and gave her a prescription for some very serious heavy-duty narcotic pain relievers. And she took the first one there in the office. It was helpful, but didn't resolve the problem. And the pain doctor said basically that that's only going to cover up and mask the pain. It's not going to correct the problem. She needed to go to a specialist. So they made an appointment. Couldn't do it that day, but we went to the specialist. They went in, they took x-rays, they examined her very closely. She was still having a problem. It was just constant. She couldn't eat, she couldn't sleep, just in very dire straits. I was really considerably worried about her. You love someone, you want them to be in good health. You certainly don't want them to be in pain. Well, they checked her out and looked at everything and said that it's a problem with the nerve, and the only way to resolve that is to operate. They want to go inside and cut that nerve. It may have to work on her vertebrae and operate. And I thought, there's something wrong here. How could she wasn't in an accident, she didn't fall down, wasn't hurt, whatever, just something had started and painful for her. So we prayed. You can get a lot of help when you just get down on your knees and ask God for help and guidance and assistance. In that time, she was a member of the Christian Chamber and had gone to a meeting and met a young man there and who was a doctor, and he actually gave a presentation, and I wasn't there, but it was a good presentation, very impressive young man. It was a specialist in some areas, and so that was fine. She mentioned it when she came home, but we were really looking for an answer to this constant pain that she was in. And we went to an activity here in our area that was and there was the same young man that she had met at the Christian Chamber was there, had a booth set up, and was explaining his process, an electronic mechanical device that he could take, and actually ran it down her back, and it printed out or presented on a computer screen the results of that scan, and it showed a really serious misalignment in her neck and vertebrae, and we thanked him, and he gave us his card and said, please, if I can get any help, we'd really like to check that out. And I said, we appreciate it. We went home. She was really just made it home, basically, because she was in a great deal of pain. And we got down, we prayed again. And I said, there's got to be an answer to this. We just keep asking the right questions, but we're not getting the answers we need. So I went online. I searched for hours and found a doctor I think it was in Michigan or Minnesota, I don't remember exactly, but he had some YouTube videos up that explained the whole process of what it was, why it was hurting, what was happening, why it was so painful, and in her case. So I emailed that doctor and had, a title, or the subject line was an emergency, and he emailed back right away and gave me his phone number, and I talked to him on the phone. I mean, mentally, I was ready to buy an airline ticket and get her up there so she could get some relief. But I asked him, I said, is there anybody in my area that can handle this product, because it's going to be expensive to fly up there and stay a few days, and you can't just click your fingers and cure her. And he said, yes, there is. And he gave me the name and phone number of that same young man, that we had accidentally been guided to twice before. And we called and we made an appointment, and we both went over to his office. He went through the whole explanation of what was happening. He gave us the answers that we needed. There was no operation involved. There's not medication involved. It was the positioning of her vertebrae in her back and her neck that was causing and creating this problem for her. So he took x-rays, he positioned everything, and we set up a program where she could go in and get help. After the very first appointment, she felt much better and had relief. Wasn't gone, but far, far much better than it ever had been in the last month prior to that, or 3 weeks, whatever it was. And she went back, I think, and being old, I don't remember everything, but it was like three times a week, or maybe 4 times a week initially. And as that pain subsided and that correction was made, it got less painful, and after a relatively short period of time, it went away. It stopped bothering her. It wasn't perfectly cured, because it was the positioning of the vertebrae had pinched that nerve or blocked that nerve, and I don't understand all of it, but he was able, through the specialty that he had in school, he knew exactly what to do and exactly what the problem was, and gave her relief. There were times initially that she could go 3 or 4 days without any pain at all, and of course it would come back because those muscles that had been out of alignment were stretched or whatever, and still didn't hold everything in place exactly. But over the span of time of her, and each week it got less amount of visits required. I think she goes once every 2 weeks right now, I believe. But she's not had the problem. The pain has left her. Occasionally she'll get a little twinge, but she knows he's taught her exactly what to do, how to position herself to relieve that stress and that pain and that nerve ending. She is so much better, so much healthier, very, very safe. Unless she gets in a lot of stress and in the environment she's in, and that, where she's not conscious of what she's doing and she sits in the wrong position or whatever for a long period of time, she starts to feel that, but he's taught her exactly how to resolve that and to set back up. Dr. Rick in North Fort Myers, he's in a clinic with his dad. They just do phenomenal work, but if you have, and I'll get the name wrong, I'm sorry, fibromyalgia or whatever, but it's if you have a problem with the pain in your cheeks and nerves, feel like it's coming from teeth, you just can't stand the pain, it's the same, probably more likely the same situation. And if you'll call Dr. Rick, he'll get you in and get you fixed up and take care of. I am so thankful. God directed us to him 3 different times, and I finally listened. And I hope you'll pray, and if you're having that kind of pain and that kind of problem, he can help you. And thank you for your time, and God bless you. Thank you.